Hi, Chris McClune here with Fire Apparatus and Emergency Equipment. Welcome to this edition of our Unbox series. Today we are going to be unboxing a handheld multi-parameter system by Nonin. It's called the Co-Pilot, and this system will monitor several patient parameters. So let's get this unboxed. We'll take a look at all the different components and we'll show you how it works. Well, now that we have everything unboxed, let's take a look at the different components. First of all, you have the Co-Pilot. The Co-Pilot is no different than your cell phone, your smartphone. If you can use your smartphone, you can use the Co-Pilot. Now, I have already started the Co-Pilot, so it's already gone through its startup sequence, which is no different than your smartphone or your computer would go through when you first start it. It's asleep right now, but I'll wake it up when we hook up everything else. Second component you're going to need is the signal processor. To turn this on, you just depress the power button, you'll wait for 3 lights to come on, and then it will start looking to pair itself up with the Co-Pilot via Bluetooth. This is the sensor we're going to use today. This is the 8330AA sensor. This will connect to the signal processor very easily. Plug it right in, lock it in, and then you just slip a finger there, and then you're ready to go. And we'll take this and we'll wake this up. When you do wake it up, it does take a second. It doesn't pop up right away with everything. It just takes a second to kind of go through, I guess, a wake up routine. But what is it going to be looking for? Well, with the 8330AA sensor, we're going to be looking for SpO2 percent of SpO2. That's your hemoglobin oxygen saturation. It's going to be looking for your pulse rate. Hopefully, mine is down there. It's usually in the 65 to 70 range. However, I am talking a lot right now, and I am a little nervous being on camera, I'm sure, so my pulse rate's going to be up a little bit. We're also going to check for percent of carboxyhemoglobin. That's going to be 0 to 99%. It will also do hemoglobin, and that is another 0 to 99% reading. Now, you can measure RSO2 as well. That's the cerebral and tissue hemoglobin oxygen saturation, but you will need a different sensor for that. You're going to need the 8204CA sensor. This, again, here is the 8330AA sensor. So once it goes through its setup process, once you wake it up, it's going to have a battery level up here. That's for the Co-Pilot itself. Your battery level down here, that is for the signal processor. And then you'll see your SpO2 percentage and your pulse rate. To get into the other screen to check for carboxyhemoglobin and methemoglobin, just press there. It's like any other touch screen, and it will show you those levels as well. Let's take a couple of minutes to talk about the importance of monitoring for CO and the Co-Pilot itself. Co-Pilot is an accurate and reliable device for measuring CO in the field. It was designed to address the high occurrence of sensor breakage for this type of instrumentation in the field in the past. Because of the sensors breaking, often those measurements were only taken in individuals coming out of a fire who were already presumed to have high elevations of CO in their body. The Nonin sensor has been designed and tested to stand up to the rigors of the environments in which it will be used. And also on the technology side, prior generations have also struggled with consistency and accuracy in their readings. What this did was it yielded either false negatives, false positives, or missed readings altogether. What this led to is sometimes firefighters that could go back in and assist to relieve another crew were held out because of a false positive and other inaccurate readings. In a clinical comparison of controlled CO exposure at 10% carboxyhemoglobin, 9 out of 10 subjects registered at 10% or greater with the Nonin carboxyhemoglobin technology compared with 5 of 10 patients with prior generation technology. And why is monitoring for CO so important during rehab? Ensuring the health and safety of our firefighters is important before, during, and after being in a structure fire. Accurate carboxyhemoglobin ensures that those fit enough to return to work can in fact do that, and that false positives are not keeping able-bodied firefighters on the bench or sent back to rehab for prolonged periods of time or for hospital for treatment that they ultimately don't need. Wanted to touch real quick on the RSO2 or regional oximetry. In this case, sensors, the 8204CA sensor will be placed on the forehead to measure cerebral saturation or over a specific tissue for regionalized tissue saturation. Why is it important? It can provide info on a patient's status during a cardiac arrest. So again, 8204CA sensor to be used with this system. Separate sensor, mostly what we were talking about today is the 8330AA sensor. Again, this has been Chris McClune with Fire Apparatus and Emergency Equipment talking today about the Nonin Co-Pilot. That is the Co-Pilot with the 8330AA sensor. If you need more information on that, visit www.nonin.com, www.nonin.com. Again, this has been Chris McClune with Fire Apparatus and Emergency Equipment. Have a good one and stay safe.